Good afternoon, everyone. Still awake? Lunch kind of settled. I want to thank first Molly and Nuna for inviting me. First time I saw it, I thought, oh yeah, I'd really love to do that. And then as I got closer, of course, I'm looking and thinking, what am I going to say? What am I going to say? How is this relevant to you? But I had a very strange experience putting together the presentation in that everything seemed relevant and none of it seemed relevant enough. So I was thinking, I'm going to a workshop on integrated knowledge translation and I'm going to be talking at the end, having never knowingly done integrated knowledge translation. This is really crazy to be preparing it in advance. I should kind of be a respondent or something. However, I'm really relieved that many of the things I've heard this morning and the questions and this afternoon, particularly this afternoon actually, really resonate with my experience over the last couple of decades in working with particularly policymakers and practitioners, but also other stakeholders in the research process. I work mostly with children and young people, or I mostly conduct research with children and young people. So perhaps some of my examples might unintentionally come from that direction, or child might appear in a slide. It's because that's what I'm thinking about when I think of participants or whatever. Okay, so I probably don't need to spend very much time on this, but my view when I first started working as a postdoc in health promotion was that I should do what I'm trained to do. It's really hard to be a good researcher. It's really challenging to get it right, or to get it even close to get it right, or even get it published. Really hard. So I should stick with what I know, get better at what I'm already good-ish at, and somebody else should do the job of explaining it to a non-academic audience. I was really, really clear. And I had multiple fights with a woman called Dr. Anne Hope, who some of you may have heard of over the years. She's now in Trinity, and she was right and I was wrong, frankly. But at the time I thought I was right. Because we have this privilege as researchers. Because privilege is a word we're familiar with now, but we feel it. This access to knowledge, this access to understanding, to interpreting, to analysing. It gives us an incredible position. It's wonderful. That's why we do it. It's exciting. But it's very elitist. And we have responsibilities that come with privilege. All privilege comes with responsibilities. And for me, initially, my responsibility was to my research participants. That the value of any work that I did with them, or they allowed me to do with them, should be theirs, not mine. I got it going through me. I got the privilege of the feeling of knowledge, of understanding. But it was for the improvement of their lives that the work was worth doing. Not mine. It wasn't for my promotion. So I think we have a really strong ethical responsibility to the research participants. And that's where I'm coming at this from, as a kind of initial non-movable stake in the ground. But also to the gatekeepers who, particularly when you're working with children, you have to work through schools, you have to work through all sorts of other environments, and people help you a lot. And then there's a quid pro quo. Our job is to help them. And of course, to our funders, we're in a small country. When we first started doing research in this area, there was very little money. The idea of going to the HRB with a piece of health promotion work or even health psychology work was laughable. And so the people who were willing to give us the small amounts of money they were willing to give us were taking a risk on us. And it was our job to deliver, not just academically, but also for practice and for policy. So I think we have a responsibility to use this privilege, the education that the Irish state gave us, for the future. And it's an ethical imperative. So I don't want to sound too dogmatic about it, but I feel dogmatic about it. Everyone has to make their own call on this, but that's where I'm coming from. So that then leads us to ask the question, well, what is this knowledge translation, and particularly integrated knowledge translation, rather than end of project knowledge translation, which we used to call dissemination? Is it something that we do So is it a task, like we do analysis and we do stakeholder engagement and we do data collection? Is it a phase or even a parallel route? Does it have its own skills and natural history? Or is it a possible approach, almost like a theoretical approach? A way of understanding what we're doing, that we align into our work? Or is it a goal or an objective? And those three particularly, I think, make a big difference to what we end up doing. Which of these three we're thinking of when we're talking about knowledge translation, but particularly integrated knowledge translation? I think I've possibly made it quite clear that from my point of view, it's a moral imperative. But there was a number of the case studies earlier mentioned that it was a natural progression, what they were doing, the work. Now, it can be multiples of these, I think. It can be what comes next, and then you get so much joy and satisfaction out of it that it starts to become something else, and vice versa. You can move between these almost on a natural journey, like the two keynote speakers this morning talked about your journey through this. In health promotion, our work is entirely, well, almost entirely applied. Our goal is to influence policy and practice. That's the point of the research that we do. In order to do that, we have to develop theory. So theory is the servant, essentially, of the impact, rather than the goal in itself. And that makes it slightly different from some other disciplines, because it's not a discipline, it's a multidisciplinary approach. So in health promotion, what we've done is we've borrowed essentially approaches from translational medicine initially. That's where these ideas, the words, came from. And adapted that into public health, mostly by the Canadians and the Australians, into public health, and then onwards into health promotion and health improvement. And I think something that hasn't entirely been disentangled today, but it's worth considering in any future structural arrangements, is this distinction between knowledge translation as a doing thing and research on knowledge translation. They're two separate things. And the second is much less frequent, but actually really important, because we do research on the implementation, but then we don't do research on the dissemination as much. So there's a big gap there. And that gap, I think, is relevant to the cultural context and the informational context and the educational context that we're working in. So while some research doesn't need to be done in Ireland, research on knowledge translation definitely does, because it's relevant to our situation. I think this is rather aligned or similar to the distinction between dissemination science and implementation science. I think that's the same kind of balance. And what you find when you're reading any of the literature or the books in this area, it's similar to other areas. You see the same or different words confusing you because they're referring essentially to the same thing. Now, we find that a lot in health promotion because we've got multidisciplines. So sometimes the sociologists are talking about something and the economists are talking about it. And they're using different words, but they're referring to the same concept. But I think this is important to point out. So I think really, in terms of how we move forward, we need to question whether we're interested in the act of translating the knowledge or in researching how that is done and improving how that's done. There, in researching. So it's an intervention in itself, if you like. This is completely illegible even to me. See it up here. So this is based on the translational research wheel from T0 up to T4, the different stages of is there a problem, what is the problem, how can we solve the problem, is the solution implementable, can it be disseminated, can it be extended and upscaled and so on. The different stages of dealing with issues. And right in the middle is methodological issues and the integration of basic and behavioural sciences, but also stakeholder engagement and the role there. So this is the model we would have worked on over the last 10 years or so. what I want to do, rather than show you a case study of a specific piece of research, is to, because I couldn't choose one, but was to show you some data on the extent to which we engage in these kind of dimensions of translational research. And just as a tiny bit of background, the Health Promotion Research Centre was founded in 1990 here as part of the National Infrastructure for Health Promotion. And we do a lot of work on a multidisciplinary basis, explicitly designed to influence policy and practice, and commissioned for that purpose, both locally, mostly with national government, but also with international governments, and particularly with the World Health Organization headquarters in Geneva. So we're an international collaborating centre for WHO Geneva, and have been for the last 9 years, and we do a lot of work directly with them, designed to advance their policy and practice in health promotion. So I had a look at all these models of translational science, or translational knowledge translation, all the various words. And I tried to collapse them conceptually down and tried to work out, well, if we want to do translational research, or research that is translation, we need to know how much of it we're doing right now. So this is it's a little bit old, but recent enough survey data, I guess, of 52 studies that were undertaken or recently finished in the Health Promotion Research Centre. So these down to here are the types of possible approaches. So is there a problem? What is the problem? What are the possible solutions to the problem? Can we implement it? Can we adapt the implementation to a broader context? Can whatever works in the broader context be further disseminated? Does it work in real life? So the difference between efficacy and efficiency, or efficiency and efficacy. What the quality of the evidence is, and synthesis. So these two are slightly out of the round loop. But you see over here that around half and up to 60% of our research is fitting in to each of those particular. So explicitly designed in these cases to influence practice in some area of health promotion. And the next slide looks, I think, more at that stuff that's directly relevant to the integrated knowledge translation function, which is either the co-production, well, again, there's loads and loads of words, the collaboration or co-production of knowledge with what the literature calls end users. And that's whoever's going to use the data, or the knowledge, or the information. So about 50% of the research projects being undertaken at the research centre are commissioned directly for policy or strategy development. So there's a gap in our knowledge and how we're going to build a strategy or an action plan, and you need to commission a piece of research to help fill that gap. But 65% of the research is directly commissioned to inform practice. A lot of that in the childhood areas. How are we going to do something specific? 70% have a stakeholder advisory group, nearly always including the funders, but often participants, practitioners, and other advisors, international academics, for example. These are the ones, I think, that are closest to the integrated knowledge translation function. So 63% include direct input from stakeholders on the design of the study, the actual experimental or research design. Just over 50% on the interpretation of findings. Given that, I would have thought it would have been higher, but that's still high. And 50% on the dissemination of findings. Fewer have a sole focus on participation, or the participants. But these are important. Will be used directly to inform policy and strategy. And this is those commissioning the research or members of the advisory groups. That's the absolute intention of the conduct of the work, or the release of the funds to do the work, is in order to inform policy. And 63% to inform practice. But 93% has the potential. Now, these are answered by the principal investigators. I didn't read all the funding applications to try and work out how it was. So maybe it's slightly overestimated on the basis of some kind of social desirability bias, but these are still very high figures, I think. In relation to collaborating with end users, this notion that you find in the literature, I don't like the term end users at all. The first thing that wanted to come out of my hands when I was writing the slide is that once you respect knowledge users, it's a non-question about whether you should engage in this. I have seen multiple examples of civil servants particularly, and some very senior and experienced civil servants being treated abominably by academics, to their faces, patronised, treated as if they know nothing. Really, really offensive behaviour. There are academics who think they're better, that they have some kind of elitist position, and it's really, really inappropriate. So once you respect the job that they are trying to do, that they are doing, that they're continuously trying to reinvent, I think the idea of collaborating with them becomes very smooth, because you're equals then, talking about the same problem. Right? And it's just like working in a multidisciplinary way. I don't know more than a sociologist. She doesn't, or he doesn't know more than me. We're just coming at it from a different background, different organisational structure, different sets of priorities and understandings. But it's the same problem. The problem isn't going to change depending on who's looking at it. I think we need to recognise that it's knowledge users that actually change our society. We're much more like midwives. They're the mothers. That probably doesn't work if I think it through. I just make I'll come up with some idea, something like that. Anyway, knowledge users are the ones that change society, and it is society that we want changed in order to improve people's health and well-being. It's them that do it, and not us. We need to recognise that they're very highly skilled, they make very complex decisions. This has come up numerous times. And they're usually very clear on what they need to know. Sometimes they're not clear that that knowledge already exists. So I've seen people try to commission work that doesn't need to be commissioned because somebody else has already done it. So a little bit of kind of, oh, you know, so-and-so in Kilkenny or Cork has done that already. But I'm very struck, I don't know if you read that recent text about Ireland being a very relationship-based country rather than a rules-based country. This whole area of academic practice, or of practice to change the world, is relationship-based in itself, and we're doing that in a relationship-based culture. So these are really key, our skills around relationships. But the collaborative structures vary over time. There's been some really wonderful collaborative structures introduced to the Department of Children and Youth Affairs, Department of Health particularly, had some great ones over time where researchers from different areas came to meet decision makers from different areas on a monthly or a bi-monthly basis, and these things petered out. A lot of things petered out around the time of the economic crash and haven't been kind of reinvented. But being there and having the opportunity or the access, just like you did, is really key. So inclusivity, in getting into that room in the first place to do the networking, to build the relationships, is really important. And I have a bit of a bugbear here about, I'm nearly finished now, about research funding. It is my experience, at least in this country, that when the research grant is really small, it's so small that you can't possibly conceive of how you could do the work that's being looked for in the time frame or the amount. You get lots of collaboration because you have lots of talk about how could you do it. Sometimes how can you cut bits off it? That's how it starts. But you build a relationship that way. When there's a lot of money involved and you have to follow European procurement policy, you're not allowed to talk to anyone. It's all out there. There's like a Chinese wall or an e-tenders wall between you and the funders. So you don't get to talk to them at all about what they need, what you can do, or have any kind of creative synergy in advance of getting the grant. And this is a problem. This is a real problem. I don't know. I think that's something that needs to be considered. Okay. So I just want to say that there are challenges and benefits. We all seem to end with that. The challenges, the personnel changes in both sets of organisations. Convincing universities that this is real work. They are definitely getting better. The social impact material, we just won an award in the research centre, Colette Kelly and I, and another colleague of ours, Michael Malco, for a presidential award for societal impact, for policy impact of our work. This is really important. Realising you have to write the journal articles first. If you're working with a knowledge user, they want to know where it's published. They didn't ask that 20 years ago. They do now. They want the citation. They want you to send them a PDF of the paper. So it's not an either-or situation. You have to do this in order to be taken seriously at the translation. Being misinterpreted, misrepresented as things, not being cited and not being acknowledged is really, really common. We see our data all over the place, which is a great pleasure, but it's never related to us. So you have to get over that ego stuff if you want to actually make a difference. I'm implying here, and it is my direct experience, that this kind of work is really extremely satisfying. This is a reason to get up and do more data analysis. I think it's an excellent use of money and energy. The money the state already pays us, essentially, if we're employed in the university. We're developing new skills, but I think the skill acquisition for early career researchers who may not stay in academia, go off and do lots of other things, and maybe even come back at a later stage in their career is really important. And essentially we're leading to the greater democratisation of knowledge and expertise, which I think should be a major impetus for us. Ultimately, we're looking at trying to get better policy, better strategy, and better outcomes. And we need to do our bit. And that's it. Thank you.